is Bernhard Thalhammer. I'm the founder and CEO of SEND.SOCIAL, and I'm very happy for the invitation. Thank you, Ed and Nasi, and the whole team for the organization, and happy to kick off the second day today. Today I'm going to talk about how to turn trust into verifiable impact, and what this has to do with Bitcoin and the Bitcoin blockchain. So let's get into it. Do you remember, do you recognize this person here? It's me, many years ago. And I grew up in rural Austria, and I grew up as part of the local church community. And what you sometimes do there every January, for January 6th, what you do is you dress up as one of the three wise men, collecting donations, but also candy. And the local church council then kind of, is looking for some communities probably in the global south, which then is receiving the donations. And maybe a few weeks or a few months later, you see maybe an oversized check being handed to a community in the global south. And this basically is a connection between what you collect in terms of the donations and what you see, what impact it creates. So this always felt like a very distant relation to each other, and I always believed that everyone had the best intentions in mind, definitely. Anyway, the connection between collecting the donations and seeing the impact is very distant and very far away. So in the end, it's all about trust, but no verification at all. So let's fast forward some 30 years. I'm a lecturer at the University of Liechtenstein, lecturing about tokenizing what makes sense, right? We've all heard the claims, and especially during the Bitcoin crowd, very critically seen, legitimately so, tokenize everything. So from the beginning, I've always focused on tokenizing what makes sense. And we've thought hard about it, what can make sense. And here on the right side, it's me, just a couple of months ago, in Geneva during the World Health Assembly, presenting SEND.SOCIAL, our project, to a couple of health ministers from Africa. And this is just a short introduction of where I come from and what I do. But maybe just to step back a little bit and ask what is the actual problem that we're addressing. On the one hand, we see that 50% of the global population doesn't have access to proper healthcare. And we can discuss many hours, days and months why this is the case. And we see at the same time that many people want to help, right? They really want to help. But we also see that sometimes up to 97% of donations going into overheads. So meaning that only 3 out of $100 are going to the cause that is intended to go to. And this is absurd. I've worked some time in the financial product industry, and if you do this in the financial product industry, the regulators want to come and lock you up for the rest of your lives. They're going to take your firstborn and they're going to lock you up and throw away the key. You're never going to see the light of day again. But when we talk about donations, people just don't care. And they don't talk about it, and it's basically, accepted, and it's okay. I'm definitely not making the case for more regulation. I think we have enough of that, but I'm making the case for more transparency, because I feel that people want to know and need to know what's going on with their money when they make a donation. So in the end, the problem is that donating feels like putting money into a black box, right? You have no idea what's happening. Now let's have a look at our solution. Let's have a look first at if this is relevant. If we look at the market as it is today, it's about a $2 trillion market per year, which is quite considerable. Half of it is impact investing, and the other half is about charitable donations and public funding. And then some people calculated that to reach the UN SDG goals, we need about $5 trillion per year. And if you compare this with the 2.2 trillion that already exists today, we talk about a funding gap of $2.8 trillion. So this is highly relevant and it's huge. Now to the solution. What we are building is a trust layer that connects the donor with the beneficiary, where the funding goes into one direction and the verified impact reporting goes into the other direction. And this is basically built on 3 layers of trust. Here in the middle we have the automated agreements and smart contracts, which make sure that the money is only released once the impact is verified. Then on the other side we have the AI monitoring. We're working with some technology partners here who already have deployed very interesting solutions when it comes to that. It's about flagging risks automatically and it's about automated verification. And then the third pillar, and I think that's the most important one here, is the human verification on site. Because we all know that technology is great and it works, but having people on site in the emerging markets who act as auditors and can be directly contacted by you as the donor or as the impact investor, I think that's a very integral pillar of the concept. So it's also about employing the workforce and give them an opportunity basically to make a living. When we look at our infrastructure, we see the donor on the one side, basically donating crypto or fiat or anything basically to the impact partner who is then responsible for the impact delivery. Which is then basically going to the beneficiaries, and what's then going back is the verification and the reporting. And what we see down here is the impact auditors, as I mentioned before. Those are the ones who are on site and who can always be contacted by the donors saying, hey, can you please go there and take a photo, or let's do a video call and check if everything is really in order there. So why Bitcoin? What does the Bitcoin framework have to do with everything? So basically we having 3 major pillars here. The first one is Bitcoin Treasury. And before I just had a coffee with a colleague here working for leading a Bitcoin Treasury company. So basically what we do is we connect or we transfer all donations directly to Bitcoin in order to have basically a natural hedge, especially in the light of basically lining up all suppliers also to be paid in Bitcoin and to pay our impact auditors also with the Lightning Network. This basically acts as a long-term storage and appreciation of value. And as I just mentioned here, the payment of the impact auditors via the Lightning Network at, of course, no transaction costs. And in some of the countries where we're planning a pilot, and I'm going to mention that on the next slide, we see that Bitcoin is already used as a yield handler. So paying basically these auditors in Bitcoin is a perfect natural fit. And in the middle, and I've mentioned it before already, we have the Bitcoin-based smart contracts. So we are planning to work with Rootstock. It's the second layer. It's also EVM compatible, so compatible with the Ethereum network. And as we know, it's the most secure and battle-tested blockchain. And there we can basically write smart contracts for milestone-based funding. So basically we can do a down payment, and then as the impact is basically traded and verified, we can release more and more of the funds here. So let's talk about what this concretely means now. We're at the moment planning a pilot project in an underserved region in Central Africa. And this means that in this pilot project we are planning to deploy Starlink terminals that are powered by photovoltaic panels in health centers and hospitals. Why is the connectivity very important? Basically 3 main reasons. The first one is, they can take better care in terms of trading, but also telemedicine. Then it's about the reliability of the systems. When we look at the communication and the health records, and also about the operational efficiency. Here on the left you see basically a mock-up of our app then, where you can really see which people are affected there, and you can make donations and really get the concrete feedback there. And why is this a perfect fit for us? Basically, a couple of reasons here with this terminal technology and the photovoltaic panels. We have direct data, basically coverage that allows for 24 hours real-time data delivery there, and every time you check on your app what's going on there, you can see the peak rate, the uptime, the downtime, and whatnot of the Starlink terminal. It's a proven technology. We have a partner there on the ground who have already deployed 20 terminals over the last 2 years. So it's very limited, the operational use there. And the most important part is we have a reliable and very trustworthy partner who we have already been in contact with for over 20 years. So this is basically our pilot project, and very likely in October I'm going to this region to visit hospitals there, and hopefully you will then see more of us in the future, also in terms of interviews and videos and whatnot. So to summarize, the problem is really about the black box impact funding without any accountability and no verification at all. Our solution is a Bitcoin-powered framework with the impact auditors on site, and it's about really giving you the real-time data and feedback. And as I just mentioned on the previous slide, it's about delivering Starlink in combination with solar power to hospitals in underserved regions, and to give you the verified impact delivery that you legitimately deserve as the one who is making the donation for the impact investment. Yes, that's it for now. Let's stay in contact. Maybe we have time for 1 or 2 questions. And thank you so much for your attention, and I'm very much looking forward to the discussions. I'll be here all day, so thank you so much for your attention.
Any questions?
How is your program being welcomed out there? How is your program being welcomed out there when you talk about it? How do people welcome when you say that crypto can be used in such a good case?
Yes.
Like we all know that if you're not part of SEPA, transaction takes days, they are very expensive. How do they welcome it?
Surprisingly well. So I had the opportunity, as I showed on the slide, present this in front of the health ministers, and they said, yes, let's go, when can we start? So if you look at some of the countries, their GDP per capita is in a range that's mind-boggling, but not in a positive way. We talk about a range of maybe $1,000, $1,500 GDP per capita per year. So when they welcome any help that's available, and they often face the, of course, problem, and sometimes it's of course a cliche, but most times, or maybe sometimes it's also true, that of course there is no accountability. So when they basically ask for help or ask for money, the standard kind of sentiment would be, okay, you're not getting anything because anyway you're going to buy a new Range Rover. And this is exactly the point where they say, okay, we want this support for whatever help we can get. So please, let's make it transparent, let's make it this accountable, so we welcome this very much.
Yes. Yes, I'm working in development cooperation, so I see the problem and also the potential of your product in terms of verification and so on. I just wonder, if you pay these community workers via Lightning, sending them with Satoshis, is this legal? Is it not putting them at risk legally, receiving them as a salary?
Yes, so in that country, I kind of don't want to really any country, but Bitcoin is used as a new panel, so we don't have any issues there. And we see more and more countries also. I think I saw a recent report on, I think that was Kenya, Nigeria, where kind of in the, let's say, low-income communities, they start to pay people in Bitcoin, and it seems to be, getting more and more widely accepted. And I think it's also the case, and of course, preaching to the choir, but also in terms of the stability of the currency. Of course, this has huge advantages. In some of the, let's say, French-speaking countries, they still use the franc CFA, which is as a fixed peg to the euro. Of course, let's say going from hell, but still kind of relatively stable in comparison to other currencies in that region. So of course, Bitcoin, I think, can be a very valuable alternative there. Any other questions, remarks? Yes, please.
Maybe only one small question. Maybe I missed it. So we already went live with this project?
No, we're building at the moment. We're building it at the moment here, and we're building it for this pilot. So, yeah, and the plan is to initiate the pilot like in the fourth quarter of this year. Yeah. Yes, that was. Yes, please.
Which measurements have you already taken into account in order to make sure that your app, your platform, your services reach the ones that are really in need and the most underrepresented in the community? Because, as we know, there are cultural differences in the global south. In many countries of Africa, the people that are already in contact with the government are the chiefs of many communities that they have the most power. And of course, within the countries, some chiefs have more. They are more powerful than other chiefs, and there are these power relations that, of course, make your project more complicated in order to reach them.
Yes, that's definitely a very, very good question. So we're lucky to have the impact partner, deployment partner that already have deployed 20 of these terminals in health centers here. So now it's about scaling this up, and to some extent, of course, we need to rely on them for having really the local knowledge there. And I think that's a very important part of the whole concept that we as a trust layer basically we cannot have 100% guarantee of everything basically being deployed. We have to rely on the partners that are on site, right? We're lucky to have this partner. We trust. We've known them for a very long time. So this really gives us a competitive edge because it's important to have these partners.
You can ask as many questions as you want during the network.
Yes, you can ask, but later. Thank you so much. Thank you.